Hello.
Hello, Emma. First of all, Emma, if you can give us your name and title.
Emma Maria Montes-Ewing, Chief Executive Officer at South Texas Health System McAllen.
And Emma, I understand you've joined STHS in the McAllen market only this year, and your first day was January the 2nd. So how are you settling in?
Very well. Yes, first day, January the 2nd. What a great way to start the year. My husband and I bought a home here and in Edinburgh, and so far we love the community. I'm amazed about all the activity and the fact that all these towns come together, and it's just amazing to see the growth. So very happy to be here.
Well, I'm sure the whole family here at STHS is happy to have you here. I understand that before this, you were based in Laredo.
Yes, I was. I was with the same company with UHS in Laredo, and I served there as the CEO at Doctors Hospital of Laredo for 3.5 years.
So, reading your biography, I was struck by the fact that you started out in the world of healthcare as a physical therapist assistant.
Yes.
Now, how many physical therapist assistants go on to become CEOs of hospitals? Would you happen to know that one?
You know what? I don't know that one. I don't know that one, but that's a great question. I think it has been an amazing experience for me. Just to give you a little bit of background, came to the United States. I was born and raised in Peru, in South America, and came to pursue an education at the age of 19. And so early on, I learned how to adapt because I came from a tropical weather, very much like here, like in South Texas, to a very cold Amarillo, Texas. So adaptation to the weather and then the language. English is my second language, so learning the English to be functional in society and be able to go to school was another challenge. And so overcoming that, I think it taught me early on how to deal with obstacles and be able to be flexible during that transition. So I got my associates from Amarillo College as a licensed physical therapist assistant, and I worked in Abilene, Texas. But ended up in specializing as a wound care specialist, and I was very passionate about the work that we did. And that's what I really learned, to work in a team environment, comprehensive, focusing on the patient first, but everybody adding something different to the table. And that's why I'm passionate about teams. And when teams can really come together and row in the same direction, amazing things happen. So there was a physical therapist, and then I had the opportunity to go back to school, receive my bachelor's, and I that's where I got the taste of leadership. I was selected to be a supervisor, and I saw how much of an impact I could do as a supervisor, in addition to being clinical. And one day I was honestly talking about the challenges and some of the things I didn't understand, why the administration did what they did and why they chose what they chose. And my mother, being a retired teacher, said, "Go back to school." So I did. Got my master's in business administration with an emphasis in hospital administration first. And with that, at the time, the company I was working for was creating a pipeline for CEOs. And so the CEO invited me to apply. And I did. I got selected. It was a very competitive type of program. And from there, I just continued to get training and became an assistant CEO, a COO, and later a CEO. I went back to school, got my Master's of Science in Healthcare Administration, because I felt, and I still believe, education is important in everything we do, and always being an ongoing learner. Got that from Trinity University, and they have one of the best programs really in the state of Texas for healthcare administration. And so that's how I became part of the executive team. I will tell you that as females, there is an underrepresentation. If you see a hospital has a majority of female workers, but um, not everybody steps into those leadership roles. So we want to encourage everybody, whether it's male or females, but we definitely want to represent everybody that wants to go into leadership. It's so important, and that's how communities further, organizations, countries. And so very excited about being here.
Okay, let's go back then. Whereabouts in Peru were you from? Are you from? And was there anyone in your family that was in the world of healthcare?
Yeah, so I was born in a port called San Juan de Marcona, is south of Nazca. If you have heard of the lines, the Nazca lines from the Incas, very interesting place to be. So I was born around that area, and my father was a mining engineer, and my mother was a teacher. So from there, we moved to a different mine, and so I grew up there. And at the age of 19, I came to go to school in the United States.
Now then, let's fast forward to Laredo. I was reading in the biography that in Laredo, during your tenure there, you were able to drive improved financial metrics, reduce turnover, and grow service lines. Tell us why those three areas are so important.
Absolutely. So one of the key things for every healthcare facility, specifically hospitals, is to understand the purpose we serve. And the purpose we serve is to provide care to a community. And so one of the things that we do as CEOs, as executives, is to analyze what the market needs. And when I was in Laredo, it was evident that more physicians were needed, more specialties, more services to be developed to prevent disease, but also care for disease. And that's what we did. Obviously, the work we do is team-based. I think healthcare is not an individual sport, it's a team sport. And so it's amazing when different team members come together and develop things. So as a CEO, I have the privilege to work with boards, with physicians, with team members, and set a strategy, look at what the community needs, and then go to our company and ask for the resources. We have an amazing company that is very supportive of the work we do. So the ability to set a good plan, a good strategy that makes sense for that community and that can be supported not just by us, but by physicians, by the community leaders, and by the board is significant. And so that's what we did in Laredo. We set new service lines. We grew profits because when you do good work and you focus on quality and safety, good things happen, like in any business. So I'm passionate about growing in supporting and really seeing what the community needs. In terms of my family, I think you asked me if they were in healthcare. I do have family in Peru that went into healthcare, more into medicine. And so I also come from a family of teachers. So that's always important. Education was instilled in us from the very beginning. And so, and my father being an engineer always taught us how to think process. And in a hospital, it's very important to think process. How do we make things better so we can work for our patients, for our doctors? Realizing that healthcare is very complicated and hospitals are complicated to run. But when we began with a good team and the support, magic happens.
I don't know if you can remember them all, but you won a lot of awards in Laredo. Can you run through a few of those to tell the viewers about how highly thought of you were in Laredo?
Absolutely. I want to talk about one of the most significant awards because it was very energizing and such a rewarding thing that happened to our hospital. So It was the Service Excellence Award. And that award is significant because our company, UHS, really values and promotes quality and safety for our patients above all. So there are scorecards, just like a report card, where hospitals are graded in their performance, and we are pushed to strive for the best. And so when a hospital is able to complete all those metrics at the end of the year and excel and achieve top percentiles of performance, in addition to all the other good things, growth and operational performance, financial performance, they get selected to compete against other hospitals that have as well performed, and that's by invitation only. So the neat thing about that is once you get invited to compete, and again, you have to do the metrics, complete the metrics before you get invited. But once you get invited, the whole hospital, the team makes a video about telling the story of what happened that year. And it's so much fun because you have all the nurses, the doctors, the staff, the CEO, everybody, the board coming together and making a video that competes against other videos. So for 2022, we won. Doctors Hospital of Laredo won the Service Award for Excellence. And that video got displayed, and our president and our president for our acute division and the president of the whole company got to be in Laredo, and we received them with mariachis, and it was amazing. But the most significant piece was to see the staff. For 2 weeks after that event, everybody was still happy, and there was just a difference in the way people walk and talk to each other. It energized everybody, but also the community and the physicians. So that's a very collective win, and I'm very proud of that.
So it sort of improved the esteem of the staff and,
Yes.
the community.
Yes, absolutely. And it's so important because the work we do, our staff faces humanity at their worst. People don't necessarily enjoy coming to a hospital because when you come to a hospital, it's because you have an issue, a problem, a health issue that needs to be cared for. And sometimes it's difficult. There are difficult interactions, but our staff is able to work through that and love people at the core to deliver an outcome. And so, but in doing that, sometimes the morale is impacted, and that's why healthcare has a high turnover. So we have to work against it. And things like that and achieving things after all hard work after a year was amazing.
So tell us a little, I know you haven't been in McAllen for very long, but our demographics are probably very similar, both border communities, but is McAllen, this market that you've joined here in McAllen, this is a bigger hospital than Laredo?
Yes, McAllen is a level 1 trauma and a comprehensive stroke center. That is huge for this area, for the Rio Grande Valley. And there is a significant amount of resources that are dedicated to this hospital to make sure those patients don't have to go elsewhere. Because going elsewhere delays care, especially when you're talking about, for example, stroke. Time is brain. So the longer it takes, the more damage. And so we're so fortunate and blessed to have the type of specialties that we have here, the trauma team, the physicians. And so I'm very excited about coming here and seeing what can I do to further and strengthen some of the amazing things that are already going on.
Yes, this hospital group I know wins awards as well. So have you set yourself any goals? Have you told your leadership team, the things that you'd like to achieve here, for the hospital, for yourself? Any thoughts there?
Yes, so amazing things are going on already. However, one of the goals that we're setting for ourselves is to be able to earn an invitation for that Service Excellence Award. And that is a lot of focus that we're going to be putting in 2024 to continue crossing all the T's, dotting all the I's when it comes to quality and service, and especially patient experience. In a hospital like ours that is so large and that is focused on the trauma and focus on taking care of the most sick. Sometimes patient experience tends to suffer a little bit, and that's going to be our goal to really strengthen all the good things that are going on and to make sure when our patients come they perceive the best experience ever, as well as to continue strengthening the quality and the metrics. And we don't aim for average, we aim for top of the charts, and that sometimes can be challenging, not because we don't want to do a good job, but because there is a whole team. It's like I always describe a hospital like a symphony. You have many instruments, many different players, but for it to work, every patient, every time, everybody has to play the instrument at the right time, at the right note, and in the right way. So coming all together and being aligned, when you have a large medical staff and large number of employees, can be significant, but it's going to be achieved.
And you mentioned earlier about the morale of the staff being so important. What's the situation like? We've obviously come out of COVID, but it was a traumatic time for the healthcare industry. What's the state of morale now? Like you said, people are leaving the industry. Are you being able to replace them? Are there shortages in certain areas that need to be addressed?
Absolutely. I think South Texas health system in general has done an amazing job. And in McAllen, at our McAllen hospital, the teams, the leaders have been able to retain. And that is a significant metric of morale. When people stay with us and they don't leave us, we call that turnover. And we measure that very intentionally. And all our metrics continue to point in the right direction. So turnover is something we work on decreasing. The less turnover, the better retention. And so tremendous job there. I think our after COVID, our heroes got really impacted. But I also know that healthcare professionals are one of the most resilient type of people ever. It's amazing how they deal with things and they come back because they love what they do. And I think when you take care of patients, and I was a caregiver at one point when I was in wound care as a licensed physical therapist assistant, there's something you get back when you give care, and it's so rewarding because patients do matter, and they are, when they get better, you get instantly something that makes you want to do it more. And so COVID was significant because no matter how good the care was, sometimes people would end up dying, not because of what the healthcare team did, but because of the virus. So that sometimes can be demotivating. But today we have closed that chapter, and if you were to see, our workforce here is very strong, very solid, very committed, and I'm just looking forward to provide that next step leadership.
And you mentioned how big a hospital it is, South Texas Health System, McAllen. How many patients on average would you see a year here?
Well, we're licensed for 450 beds, and so it's a significant number of beds, and we see a large number in our ED coming in for level 1 trauma. And what we're going to be working is enhancing and really providing what this community needs. So again, some of those cases don't have to go elsewhere, and really bringing and attracting more specialties. We're in the process of bringing a new neurosurgeon to this community and working with the other surgeons and supporting what they do. Recruitment is important to be able to care for the large number, almost 1.5 million people in this area. So we want to definitely do our part there.
So bringing that neurosurgeon in, is that like new for the Valley?
It is. So we do have neurosurgeons, but definitely for the amount of people we care for, we want to add another neurosurgeon so we can have enough specialties to care for our patients.
Well, Emma, I really appreciate this interview. I don't have any other questions myself, but is there anything I've missed, any areas that you feel that you'd like to tell the viewers about this hospital system and your work here? Anything I've missed?
The only thing I would add is, and thank you for your questions, wonderful questions, is the how we need to be aware in this area in our community of how blessed we are because there's significant growth, and there are other areas, other hospitals in the country that were impacted by COVID, where sometimes communities disintegrate and they're not growing, and so therefore the hospitals can grow. Here it's all the opposite. Here you see that growth and is thriving. People are moving in. There's construction happening, new restaurants, new shops. So it's nice to be able to be part of that ecosystem of services that care for the patients. In healthcare, we are in the business of caring for people, and it's nice to see that we can do that while the community is growing. So it goes hand in hand, and I look forward to being part of this community and serving the community.
Well, Emma Montes-Ewing, CEO of South Texas Health System, McAllen, thank you so much for today's interview.
Thank you.